My name is Marcella Carragher. I'm a postdoc researcher in the aphasia CRE, and I'm presenting this work in collaboration with Dr. Robyn O'Halloran, who is an investigator within the CRE. And as Ciara already mentioned, we're going to be talking about COVID-19. Of course, it's a terrible virus that has claimed lives across the world. But for the purpose of this talk, we ask your permission to think about an opportunity that COVID affords us in reimagining healthcare communication. Now, this work fits within the Aphasia Research Hub. A specific part of the hub is dedicated to increasing inclusion, as Ciara just spoke about, in terms of including people with aphasia in stroke research and in healthcare. During the COVID-19 pandemic, we have all had to urgently find new ways to live our lives. COVID has disrupted life as we know it. All of us have faced substantial change and inconvenience in our personal and professional lives. But with this disruption comes an opportunity for innovation. Tough times call for new ideas, tools, and services that can help people to adapt to the new world around them. For example, in the depths of the global financial crisis of the late 2000s, businesses were created then that are household names today. So in the context of healthcare, what does disruption and innovation look like? Well, as one example, we have seen the introduction of personal protective equipment, or PPE, as a mandatory measure for staff and patients. These protective measures are essential in limiting the spread of the virus, of course, but health providers and patients have reported that PPE makes it difficult to communicate. Some PPE looks intimidating, while others mean that facial expression is no longer a viable communication channel. In this context, something exciting has happened. Health providers en masse are becoming more aware of healthcare communication and the barriers to good communication. Moreover, they've started doing something about it, such as wearing their photograph on their uniform, designing masks where you can see the health provider's mouth to facilitate lip reading, and developing flashcards on iPads to use at the patient's bedside. This in itself is exciting. Never before have so many healthcare providers been thinking about how they communicate with patients. So one positive aspect of PPE is this generalized increased awareness of healthcare communication and the need to adapt to the PPE environment. This benefits all patients, but it could be particularly valuable to patients with communication vulnerabilities, including those patients with aphasia. We have known for a long time that patients with aphasia are dissatisfied with healthcare communication in hospitals. They report that information is not provided to them in a way that they can understand, and they're not given the supports they need to join in conversations about their own healthcare. Education and training programs are available, but these can be a hard sell to other members of the team, particularly in acute settings. Increased awareness of the need to adapt healthcare communication provides a valuable opportunity to those of us who work with patients with aphasia and other communication vulnerabilities. In this time of disruption, this is our opportunity to write new rules, to change a system that never worked for patients with aphasia. With healthcare professionals making their own quick fixes, as we saw in one of the previous slides, where do speech pathologists fit in? Well, there's been mixed reactions amongst speech pathologists. For example, as this tweet shows, there's been disappointment and frustration that doctors are getting credit for seemingly inventing flashcards when we know that speech pathologists have been using communication boards and charts for decades to help patients communicate. On the other hand, some speech pathologists may feel that supporting healthcare communication does not fall within our remit. While it's true that we're not responsible for all healthcare communication, we want to suggest to you that it is in our remit to advocate for and lead the way to ensure good quality healthcare communication for patients with aphasia. There's a huge variety in the people who work in healthcare settings, including medical staff, allied health staff, administrative staff, catering, porters, and drivers. Healthcare communication is everyone's business, and it's a huge task that can't be solved by one profession. Nonetheless, there are leadership opportunities for speech pathologists to step up within their healthcare services. In these times of when our multidisciplinary colleagues are explicitly thinking about healthcare communication, we can use this opportunity to shoehorn into the conversation the issue of patients with communication difficulties. Speech pathologists have knowledge and experience of working with individuals with communication difficulties. So this means we've got something to contribute in the broader discussion of communication accessibility for all patients. Most healthcare systems do not have policies, frameworks, or system-wide resources to support their staff to compensate for the effect of PPE on communication with patients. So these amazing innovations that we're seeing, such as doctors using flashcards on iPads, they're not enshrined, they're not protected, they're not resourced at an organizational level. So at the moment, the onus is really on the individual healthcare professional to provide good quality healthcare communication. And there's a real risk that all of this, the increased awareness, the creativity around improving healthcare communication, all of this could disappear once the need for PPE has passed. There's a risk that we could return to business as usual. Now I'll hand over to Robyn to discuss what we can do about that.
Great, thanks Marcella. So I'll continue on. Great. So what can we do to ensure that increased awareness of healthcare communication is sustained and sustainable post-COVID? Well, we know that patient-provider communication is a two-way interaction that's going to be influenced by patient-related factors as well as provider-related factors. And if we think about patient-related factors, a patient's ability to communicate with their healthcare providers and also their ability to compensate in the presence of communication barriers like PPE will be reduced if a patient has a different cultural background or different ethnic or linguistic background from their healthcare provider. It will also be reduced if a patient has low literacy or low health literacy, or if the patient has a communication disability, like a hearing impairment, a vision impairment, a speech, language, or cognitive communication impairment. Any of these patient-related factors put the patient at high risk of poor healthcare conversations, and they may need communication supports to enable them to communicate and participate in their healthcare. And we also know that there are provider-related factors that influence that interaction. And some of these factors, importantly, can be changed to support patients in these healthcare conversations. Patients are better supported in a healthcare conversation when healthcare providers have the right attitudes, when they value patient-provider communication. Patients are also better supported when healthcare providers have access to education and training so that they develop the skills to be able to communicate with patients with a range of different abilities. Patients are better supported when hospitals have the services, the systems, the policies and the procedures in place to support patients, families and healthcare providers to communicate. And patients are better supported when the hospital environment is conducive to communication. So when there's good lighting and when there's low levels of background noise. And finally, patients are better supported when healthcare providers have the physical resources they need to support those face-to-face conversations. So these are all factors that in theory can be changed, improved and refined. So what can we as speech language pathologists do? Well, we think that there's two key things we can do. And the first one is that we can resource healthcare providers. And we can do this in two ways. We can resource healthcare providers by providing them and the wards with the physical resources they need to communicate with patients. And we can also resource them by providing the education and training that they need to support conversations with patients with different abilities and in different contexts, like with PPE. And we also think that this is an opportunity for speech pathologists to show some leadership. Speech pathologists could be advocating for good quality healthcare for all patients with and without PPE. And as we were thinking about this, we were thinking speech pathologists, we could start a conversation with our managers, with ward leaders and senior management, drawing attention to the fact that COVID has emphasised the importance of healthcare providers adapting how they communicate with patients in different situations. We could also provide consultation when there's redesign or refitting of hospitals to ensure that there's good lighting and low levels of background noise. We could work with human resources departments when they're writing those job descriptions so that we give preference to applicants applying for jobs who value patient-provider communication and have skills in patient-provider communication. And we could also work with hospitals to develop systems and services that actually support patients, families and healthcare providers to communicate. So one example would be to manage rostering systems so that we deliberately roster healthcare providers who have skills in communicating with the patients who need those supports. So what are some changes that you could make now? Well, one way you could provide supports is by providing some physical resources. All over the world, healthcare providers have been busy developing resources to support patients with aphasia, particularly as it relates to COVID. And the Aphasia CRE in Australia has collated many of these resources together into a handy Excel spreadsheet. And we'd invite you to have a look at these resources. They're on the website, and to share them with your multidisciplinary team. Another resource that's on the website is available to support the development of policies and procedures to support patients with aphasia leaving hospital. So the Australian Aphasia Association consulted with clinicians to develop the leaving checklist. So this is a free resource again, and please check it out and share it with your multi-D team. Feel free to adapt it as you need to for your local context, but make sure healthcare providers who are involved in discharge planning with people with aphasia provide the kinds of supports that are listed on this checklist. And finally, if you want to look at provider-related factors more broadly, you could conduct an audit of the local environment by using a questionnaire that's in the inpatient functional communication interview, screening, assessment, and intervention that was published this year by Plural Publishing. This is one of 3 questionnaires in that resource to help you and your team highlight the resources that you have available to support communication on the ward, and also some areas where you might need to develop and improve to support communication. So in summing up, we've got some key take-home messages for you. The first one is that historically we know that healthcare services have not done a good job supporting patients with aphasia and patients with other kinds of communication disability to be part of healthcare conversations. The need for PPE has brought healthcare communication to everybody's attention, and it's become clear that healthcare communication is everyone's business. But within that context, we think there's a real window of opportunity here for speech-language pathologists. We've got an opportunity to advocate for people with aphasia and people with other kinds of communication disabilities. And we can do that by using resources that are already available. Please introduce them to your teams, share them especially with your multidisciplinary team colleagues, and to build on the awareness that's already there. Feel free to adapt them to your setting so that we can start to realise some sustainable change. And I guess in summary, we really think this is our opportunity to develop communicatively accessible systems so that patients with aphasia and patients with any other kinds of communication disability can be included in these healthcare conversations. It's a real opportunity for us to rewrite the rules. Thank you. So there are details there, and I think due to time, Todd, we probably may not have time for questions or comments.
Yeah, I do think we do need to keep moving forward. If folks have questions and comments, you can email them to Marcella and Robyn, or send them to us. And gosh, I'd love any chance to say hello to both of you and say thank you after the fact again,
Great.
and go from there. But thank you.